Good day, everyone. It's another episode of Med Talks with Murray. And for today's episode, we're going to talk about wound suturing. For today's demonstration, we're going to be using simple interrupted suturing technique. This is the most common technique to close a wound. For the materials, we will be needing a syringe, a local anesthesia, sutures, needle holder, pickup forceps, surgical scissors, surgical pad, and a pair of gloves. We draw with the syringe the desired amount of anesthetic to be used from the bottle. Make sure to always observe sterility. Remove air bubbles from the syringe. Inject with bevel up into the desired area subcutaneously. Always remember to aspirate before injecting to make sure that no vessels were hit, as there will be backflow of blood. Track the effect of anesthesia using the tip of the needle. With your dominant hand, use the ring finger and thumb to hold the needle holder in a prone position. The other hand will hold the pickup forceps with a pencil grip. Load the suture into the needle holder properly using the forceps. Remember to never use your fingers. Hold the needle 2/3 of its midway and start the suture 1 cm from the wound perpendicularly. Gently rotate your wrist following the arc of the needle until it exits on the other side of the wound. Then adjust the length of the suture. Form an instrument tie or a square knot. The knots are usually placed on one side so as not to disrupt the healing process of the wound. Use the suture scissors to cut the suture 1 cm away from the knot. The procedure is repeated along the entire length of the wound. We then test the integrity and strength of the sutures using a curved Kelly. It is important to educate our patient on proper wound care to avoid any complications. That's all for today's episode. Thanks for watching and tune in for next episode on Med Talks with Murray.